Chadderdon. Again, January is Glaucoma Awareness Month. I'm going to talk a little bit about some of the things that we do in the office when we think somebody is at risk for glaucoma. There are several tests that give us information about how much risk, or if somebody does have glaucoma, how to monitor that. One of the things that people don't like very much is called a visual field. Basically, you sit and look into a background and see when white lights flash. You have one eye patched, and it takes a period of time, and so it's looking for the sensitivity of your retina in various positions. In glaucoma, the nerve tissue is lost and damaged, and you lose some sensitivity, and so it gives us information about how much damage is done or if that damage is increasing over time. Another test that we do is we check your eye pressures. We usually can use a couple of different methods. The most common is to put some drops into your eyes and to gather information as to how much resistance your eye has, and that tells us a pressure reading. Typically pressures of 20 and above are high risk. For some people, pressures lower than that can be a risk depending on what their average pressure had been throughout their lifetime. We also do tests that look at the space where the fluid drains out of the eye. A common test is called gonioscopy. We put a lens up near the eye, and it lets us look into the space where that fluid drains to see if it's narrow or potential to close. Also, there's a test using an ultrasound that will get a little more accurate information about that drainage space. We also do a test called an OCT. Basically, it's getting a scan, a laser scan of the back of your eye, and particularly the nerve tissue. It tells us the size of the depression in that nerve tissue. The larger the depression, the more likely it is that that nerve could be damaged. And also it measures changes in that depression size over time. If that depression is getting larger or deeper, that would definitely indicate advancing of glaucoma. We also measure the thickness of your cornea. Thinner corneas that are at a greater risk for glaucoma than thicker corneas. People that have had LASIK, sometimes their corneas are thinner, and so we have to make adjustments in their pressure reading. Also, we do a test called a VEP, where electrodes are attached, and we're trying to figure out how much information that's presented to your eyes gets processed, goes through your optic nerve and back to the vision part of your brain, which is in the back part of your brain, and we're trying to figure out how much that information gets processed and gets there. If all of that information is getting there unscathed, then your risk of having damage is low. If some of that information is impeded, that can be an indicator that your optic nerve is being threatened and damaged from glaucoma.